Contraception, aka birth control, aka family planning, is the use of various methods such as drugs, devices, agents, sexual practices, or surgical procedures to prevent pregnancy. Birth control can be permanent or temporary. Welcome back. My name is Lucy. I'm a pharmacist and a nurse, and in this video we will look at things to consider when deciding on birth control method and a brief overview of birth control methods. The right method of birth control for you and your partner may depend on effectiveness in preventing pregnancy, possible side effects, number of sexual partners, frequency of sexual activity, reversibility. This depends on whether you want to get pregnant soon, in a few years, or never, overall health, and the cost. The first group of birth control method is the barrier method. The idea is to block the sperm before it gets through the cervix and to the egg. They have to be removed after use and cannot be reused. We have condoms. There are two types of condoms: external condom or the male condom. It is a thin rubber tube that covers the penis. It is rolled onto the penis before sex. They can be purchased in gas station, pharmacy, or supermarket. The second type of condom is the internal condom or the female condom. The female condom is inserted into the vagina and sits on the opening of the cervix on one end and covers the external genital on the other. It can be inserted 8 hours before sex. They are harder to find than the male condoms but can be found in family planning clinics, some pharmacies, and on the internet. Remember, only condoms protect from sexually transmitted infections such as HIV, chlamydia, and gonorrhea. Next, we have diaphragm and cervical cup. These are cup-shaped devices made of thin, soft silicone that are inserted into the vagina before sex. The cervical cup can be inserted up to 6 hours before sex, and the diaphragm can be inserted up to 18 hours before sex. And they should stay in place for a minimum of 6 hours after sex, but not more than 24 to 48 hours, depending on the specific type. They both need to be used in conjunction with spermicide. In order to use diaphragm and cervical cup, you will need to be fitted by your healthcare professional to make sure you get the correct size. The next group is the hormonal method. These include pills, implants, injections, patches, rings, and IUDs. They release synthetic estrogen and progesterone into the women and reproductive system, preventing ovaries from releasing eggs and or making the womb sort of inhospitable environment for fertilized eggs. It is important to know that all these hormonal methods of contraception might change the woman's period and cause side effects. The first hormonal method is birth control pills. This is the most used method. The pills needs to be taken every day. There are two types of pills. We have the combined pills that contains estrogen and progestin, and we have mini pills that contains only one hormone progestin. The second hormonal method is vaginal ring. It is a small flexible plastic ring that contains two hormones progestin and estrogen. The woman wears the ring in her vagina for 3 weeks and then removes it for 1 week during menstrual period. The third hormonal method is transdermal patch. It contains estrogen and progestin. It is applied every 3 weeks and off the 4th week. The patch can go on the woman's buttocks, on the stomach, upper arm, or on the back, but not on your breast. Choose a place that works for you and make sure you stick with it all week. You can always change the location when you put on a new patch on the next week. The fourth hormonal method is the birth control shot or Depo-Provera. It contains one hormone progestin. There are two formulations. So we have the intramuscular formulation, which is injected into a muscle, and the intermuscular formulation has to be administered by a healthcare provider in the woman's buttocks or arm. And then there is subcutaneous injection. This is injected under the skin. The subcutaneous injection can be self-injected at home in the thigh or belly. It has a smaller dose of hormone progestin. Both formulations are given every 3 months or 12 weeks. The next hormonal method is the implant. The implant is a small plastic rod about the size of a matchstick. It contains hormone progestin. The implant is inserted under the skin of your upper arm by a doctor. It can last for 3 years, and usually fertility quickly returns when the implant is removed. Next is the intrauterine device or IUD. There are two types of IUD. So there is a hormonal IUD. It is a small T-shaped plastic that contains hormone progestin. The hormonal IUD can last for 5 years. Next is the copper IUD. It contains a piece of copper instead of hormone. The cold copper works as a spermicide to kill all the sperm before they can ever reach the egg. It can last up to 10 years. Both hormonal and copper IUD are placed inside a woman's uterus with a string hanging out towards the vagina. The IUD are removed using the string by a specially trained doctor or a nurse. Usually, fertility quickly returns when the IUD is removed. Next is permanent contraception or sterilization. For women, we have tubal ligation. These involve clipping or tying of the fallopian tube. These are the tubes that connect the ovaries to the uterus, and this stops eggs from moving into the womb. For men, we have vasectomy. This involves cutting the sperm ducts to stop sperm from being discharged during sex. These are extremely effective medical procedures. They are considered permanent, so when you decide to get sterilized, be 100% sure you do not want kids. Besides condoms, vasectomy is the only other available effective male birth control option. Next, we have natural family planning. This includes calendar method, basal body temperature method, and cervical mucus. This involves a woman tracking all her cycle and avoiding vaginal sex or using other methods of birth control on the days of the month when she is most likely to get pregnant. These methods may not be as reliable as using condoms, hormonal methods, or the copper IUD. It is difficult to get it right because everyone is different, so speak to your doctor if you are considering this type of family planning. Next is withdrawal method. This involves the man removing his penis from his partner's vagina before releasing sperms at the sexual climax. Even if a small amount of sperm touches the vagina, it is still possible to get pregnant. Be aware that some sperms can be released before the man climaxes. Next, we have emergency contraception, or sometimes referred as morning after pill. This is used when you're worried that you might get pregnant. So when you have unprotected sex or when contraceptive measure fails, so like if you have a broken condom or missed or late pills or no contraception used at all. Speak to your pharmacist, doctor, or nurse about options if you find yourself in this situation. Medication can be bought from pharmacy and needs to be taken as soon as possible and up to 72 hours after sex for it to work. The copper IUD can also be used as emergency contraception. Speak to your doctor about the copper IUD option. This table from bedsider.org shows the birth control method's effectiveness from least effective on the bottom to the most effective on the top. Be aware that even the most effective birth control method can fail. Some have higher effective rates than others, but no method is 100% effective. If you are unsure of which birth control method is best for you, speak to your doctor or healthcare provider. And those are all the main methods of contraception. Thank you for watching. Like and share the video and subscribe to the channel if you like this kind of content.